a center that is dedicated to trying to stabilize the health of patients who are sick, who have had a high utilization in the hospital recently, and then trying to empower them to have long-term success by being able to manage their care in the community. Really, a lot of it was through analytics. And we started looking at our patients who were in the hospital the most, who were the sickest. A lot of the things that were driving poor outcomes had nothing to do with hospitals or clinics. It was the struggles that our patients were facing on a daily basis, the social determinants of health, the poverty, the lack of access to insurance. We have a therapist team, we have a care manager team, and it's really this team-based approach. In the short term, stabilizing their medical conditions, giving them access to medications they need, giving them access to the behavioral health they need, or whatever resources they need. But then in the long term, how do we get into kind of empowering the patients to learn more about their health, whether it be exercise or mindfulness or stress reduction? Like you really have to address the mental health piece if you're going to get to the medical piece. You kind of treat the symptoms. Sometimes you can almost view like the diabetes and the CHF as symptoms of kind of a behavioral health disease that is driving these poor outcomes. We keep pushing and keep asking ourselves why, and keep trying to get at root causes. As you look for, what are those root causes? A lot of times it not only goes to behavioral health disease, but trauma. And so being able to have therapists, being able to be trauma informed has been a really important piece of our success to date. Healthy patients cost less than sick patients, and healthy patients suffer less than sick patients, and healthy patients are more satisfied than sick patients. And we share the model with other hospitals, and we share the model with other communities and say, I think we're onto something here. And this is something that you should consider, especially if your system is going into value-based care, especially if you're going deeper into population health. But that's the thing that I think is going to be really exciting moving forward, is to take this model and branch it out in the community and start to address some of these historic health inequities that have made certain populations along socioeconomic lines more vulnerable to poor outcomes.